I am an Ashoka Fellow based in South Africa, Johannesburg. I run an organization called Technovera that focuses on improving access to medicine for patients that are reliant on state-funded care. The core problem that we're trying to address is ensuring that somebody who's spending 3 hours in a queue can be able to access their medicine in a couple of seconds, leveraging technology. For our COVID-19 innovation, we've introduced COVID-19 testing booths that create 100% isolation between the clinician or the nurse that is collecting the swab during the process of testing. We've also looked at expanding our Bella Box solutions, primarily because they provide a contactless mode of being able to get patients to collect treatment at healthcare facilities. We are effectively building a strategy of increasing access to medicine for patients that ultimately don't want to be spending time in a queue for 3 hours, potentially increasing their risk of contracting COVID in a densely populated area such as a clinic, a public clinic. And then additionally, we are trying to improve the safety of our frontline workers that are effectively collecting these swabs so that we can be able to have an indication on how our COVID response is operating. Currently operating in South Africa, in particular Gauteng, KwaZulu-Natal and Northwest and Western Cape in terms of provinces, and starting to scale the Pillar Box lockers to Namibia and Eswatini. Thank you very much. We're looking for partners that are able to help us figure out our scaling journey and be able to help us also attract partners that can help with this particular process.
We provide sterilized baby delivery kits to pregnant women in rural areas and low-income communities. I developed the kit when I was pregnant myself with my first child, and I was asked by the hospital to bring my own birth materials: gloves, scalpel blade, delivery mat, cotton wool, disinfectant. And I was shocked. I had to provide these things myself. And I really had a struggle to find everything in one place. And I felt, if I'm struggling, what are other women who are in worse situations going through? Which is what led me to come up with the delivery kit and pack everything in one kit as recommended by WHO. And we're working with the Ministry of Health in Zambia. The impact on the women has been phenomenal. We've been able to provide them with life-saving products. We're currently working in 6 clinics in Zambia. We have about 20 clinics that are on the line waiting to roll out our kits. We're looking to end the year having sold 10,000 kits this year.
We caught up with Muzalema in Zambia to find out what impact COVID-19 is having on their efforts.
We are deeply concerned. We have been monitoring the situation since we first heard about the pandemic in December 2019 and have been amazed at how it has traveled from its original state in China to globally around the world. And now it's in Africa. We are on lockdown. Nobody was prepared for it. WHO is trying their level best, and so is our local Ministry of Health, to be able to carry out testing and as well as advise the public on safety procedures.
Greetings from Nairobi, Kenya. I'm Moka Lantum, the founder and chief executive hostler for Checkups Medical Center. Myself and 50 other colleagues wake up every day to get medicines, diagnostics, and treatment to as many people as we can, as fast as we can, and at the best price possible. With the advent of the pandemic, many people were not sure where to get care. The usual public places where people would go for medicines were no longer safe. The elderly were stranded, women and children stuck at home. We felt the need to respond to that gap. We partnered with Boda Boda riders who knew the local community. We trained them, gave them the right PPEs, and gave them data bundles to be able to go knock on doors. Each rider knocks on 60 homes a day, and they generate teleconsultation visits with our doctors. We write prescriptions and dispatch medicines. Since the pandemic, we've served over 30,000 homes, done over 3,000 teleconsultations, and now close to 1,000 people have had the benefit of receiving medicines at home, especially the elderly, women and children.
The Shona Group social enterprise have been working for more than 30 years for the inclusion of children with disabilities and their families. One of the ways in which we do this is through the supply of POSH support wheelchairs, services and training across South Africa. Wheelchairs that are manufactured locally in our ISO 9001 certified factory, providing high quality, locally manufactured products and creating disability inclusive jobs.
A few months ago, I started realizing that the supply of PPE in South Africa would be a huge problem for the people we worked with.
Oggy Air is a powered air purifying respirator that delivers safe, clean, filtered air from a portable respirator unit into a lightweight hood. This is the Oggy Air, our prototype 2. It incorporates all the components and functionality of a powered air purifying respirator in a well-designed compact unit that's comfortable to carry. It has high-efficiency particle filtration, 9 hours of lithium-ion battery life, and a blower motor which provides good airflow up through this breather tube into the hood. The hood is made of a soft structure which creates a barrier between the user and the outside environment, protecting them from airborne contaminants. The visor itself offers clear vision and good peripheral vision, with the visor extending all the way to the side of the face. Inside the hood, it's supported by an adjustable harness which provides hours of comfort and can be adjusted to a number of different sizes.